When people think of reasons ambulances are needed, heart attacks and car wrecks are almost always at the top of everyone's list. At St. Charles County Ambulance District, we respond to our fair share of these calls. But as you'll learn over the next 2 minutes, there are many other types in the mix as well. Calls related to cardiac and circulatory function comprised about 8% of our 32,000 calls last year. Strokes, syncopal episodes, and other neurological calls came in at about 5%. Respiratory-related calls, which encompass all variety of breathing problems, comprised 6% of call volume. Calls related to diabetes came in at 2%. Typically, these calls are for dangerously low blood sugar levels, but we do occasionally respond to calls for hyperglycemia. Obviously, we respond to more obscure cases as well, and it would take us all day to list them. For today's purposes, we'll call these general sick cases, and they comprise 10% of our total call volume. Residents are often surprised to learn that 12% of our calls are behavioral health related. These include everything from individuals suffering from Alzheimer's to drug overdoses. Suicide attempts and other psychiatric issues are also included here. Patients experiencing severe pain make up 5% of total call volume. These calls can include everything from abdominal pain brought on by appendicitis to ear pain related to a severe infection. Hemorrhages and other bleeding-related issues make up about 1% of total call volume. Another broad category of calls is traumatic injury, which encompasses 15% of total volume. Broken bones, burns, and other injuries are included here. The mechanisms of injury on these calls vary greatly. We see car crashes, falls, construction accidents, and everything in between. Environmental emergencies such as animal bites, weather-related issues, and poisonings comprise about 1% of calls. Routine transfers are another large category of calls at 12%. These are patients who need to travel by ambulance, but the situation is not life-threatening. For instance, after a knee or hip replacement at a hospital, a patient may need to travel to a skilled nursing facility for rehab. Calls in the other category comprise 10% of total volume. These are general, non-illness types of calls that do not fall under sick case. Examples would include hernias, skin problems, and other less common issues. Our final category is canceled calls and non-transports, which come in at 13%. Sometimes, emergency crews are summoned to an accident scene or other issue, only to find that the situation is not as severe as initially reported. If nobody is injured or ill, we head back to the station. Also included here are citizens assist calls, which we respond to regularly. Typically, these are cases where someone has fallen and is not seriously hurt, but cannot get up. As you can see, our mix of calls varies greatly from day to day. We hope you don't have to utilize our services, but no matter what your emergency, your SCAD paramedics are here to help.